Welcome everyone to Amara's Critical Conversations, how we can support African American, Native American, and LGBTQ youth in foster care. My name is Trey. I work for Amara as our family outreach specialist. That essentially means I kind of lead our agency's efforts in recruiting more foster families to work with Amara. So go out and meet with various community folks and just kind of educate about the need for more foster homes, conduct our info sessions to learn more about our foster care programs, and just kind of be the first point of contact for anyone interested in working with Amara. And then personally, I'm also a foster parent. Currently have a 3-year-old little guy, biracial, African American, and Native American. So this topic is dear to my heart, both professionally and personally. So I will start out by introducing our great panelists, and I'll just start from my right and move that way. So first we have Larisa Koenig, is the Native American Liaison for Washington State's Fostering Together program, and is an enrolled member of the Alaska Native tribe of Tlingit and Haida. She has dedicated the majority of her professional career to serving Native American children and families in numerous ways, including working as a mental health provider to children in foster care and managing supervisor of the tribal child welfare program. All right, and then next to her we have Dr. Marian Harris, who is a professor of social work at the University of Washington in Tacoma. She has written several journal articles, newspaper articles, book chapters, books, and reports related to the child welfare system, disproportionality, and incarceration. And then last but not least, we have Shogren, who is the LGBTQ, disproportionality, commercially sexually exploited children program manager for DSHS's Children's Administration. She has over 20 years of experience supporting children, youth, and young adults through various roles. In Olympia, Day serves as co-administrator for Renew's Women's Group, serves as the board VP with Empowerment for Girls, the Community Foundation board member, and volunteers in her son's classroom. So briefly now I'm going to have each person talk briefly about kind of what population they're going to be talking about today and any other information they want to add that I did not say in their introduction.
There we go. So he pretty much said everything you need to know, I guess, except for that I also am a foster parent and an adoptive parent of tribal children. And so I'm going through that experience again with some new placements that were siblings to my kids. And then the other piece is probably just with fostering together, that's similar to what Trey does. We're looking for just recruiting and retaining and supporting people to care for not only Native American children, but we support foster parents regardless of where they're licensed, whether it's a private agency like Amara or through the state. And we also keep statistics and bring that information to the public the best we can. And so the biggest piece with the Native American population right now is that approximately 20 to 25% of the kids in care in Washington State are Native American. And there are approximately 9,000 kids in care, maybe a little over right now, and over 2,000 of those are Native American kids, so that's a big population.
I've been working in child welfare my entire professional career. I started out as a social worker for the Children's Home Society of Florida, and I realized at the time I was doing foster care and adoptions that something was wrong with the child welfare system. I discovered that we had more Black infants in care than any other babies at our agency. And I wasn't a researcher at the time, but again, I noticed that something was wrong with the system. I moved on many years later and was an administrator for a private child welfare agency in the city of Chicago. And then noticed that there was something wrong in terms of Black or African American children. We had too many of these children in the child welfare system. But I worked for a private agency, and we had lots of money, and we could work to reunify children and their families without a lot of restraints placed on us. And so I decided at the time that I was going back to school because I wanted to do research, I wanted to become a professor. and the only way to do that would be to further my education. And I did that, and that was way back in the 90s. And my dissertation focused on African American birth mothers and their children in kinship care. And I have always believed that children should be with their birth parents. And if they can't be with their birth parents, they need to be with their family. And when I say family, I'm talking about somebody in their family of origin, either grandparents, aunts, uncles, but somebody who's kin to that child. And so I have focused a large part of my research on kinship care. Disproportionality for children of color, and I am concerned about all children of color, although I was asked to come here and speak about African American and Black children today. I have been to Congress to testify about this issue for several years. I co-chaired the Washington State Racial Disproportionality Advisory Committee. I have written numerous articles. I've done research. I wrote this book 4 years ago because it's an issue that's near and dear to my heart. And until the child welfare system really decides to address the issue of racism in that system, we're not going to resolve this issue.
It's a good thing we're on the same side of the table. Tough act to follow. Habitually, I'm going to say good morning to everybody. I know that it's almost 4 o'clock in the afternoon, but it doesn't matter what time of day it is. I always say good morning, and I don't know why. So good morning. Thank you, everybody, for being here with us. Again, my name is Shogren. Shout out to Trey for being able to reiterate my title, first and foremost. It's a little ridiculous. Thank you for bearing with me on that. So I've been asked to come talk with you all about the LGBTQ disproportionality that we see in our children and youth and child welfare. Let me back up again really quickly. Again, Shogren, I use she, her pronouns, and I've been doing this work inadvertently with LGBTQ identified children and youth for about 25 years, but I've been in child welfare for the last 5. My work is centered based in Olympia, so I manage statewide programs. So while this topic isn't new to child welfare, the work around it, we're quite eloquently saying it more out loud. Back in 2008, the WSU came in and did a phone survey around children and youth who identified as LGBTQ, looking at their identities, looking at their sexual orientations, how they express themselves. But since then, we haven't had any of that work duplicated. That's happening now. We also are working on providing more training. We haven't mandated the training yet, but we're looking at and have been implementing more training for our staff and our caregivers around LGBTQ specific issues. And that training involves everything from terminology. As anyone who might be familiar or know with the LGBT community, some of this language is consistently changing and growing, and it's really difficult to stay current. So we're really trying to just get some of the basic language and terminology out to folks. And when I say basic, I mean defining LGBTQ, or defining sexual orientation, or defining gender identity, and defining gender expression, and helping folks understand that that is a non-binary spectrum that folks are identifying on as young as 3 years old. Right, we're not waiting for adolescent stage, which often we see more and more because youth are coming into more of that voice, and they're going to be questioning more that we see, but really it happens before then. So how can we create a home for that child or services for that child that are best going to meet their needs? The training also involves addressing the disproportionality, highlighting some of the experiences that youth are experiencing, better approaches to engaging children and youth, and looking at some of those specific needs, as well as encouraging safe spaces, whether you're a caseworker, or you're a missing care locator, or you're a provider that we're working with in the community. How can we help create those spaces for our young people to feel like they have some place to go and talk to and feel safe in that? And there's a lot of work around that. I have to remind myself quite constantly that I live in a bubble where I'm surrounded by people who are really proactive around this work. And then I step outside my bubble and I realize that I'm still defining for people what LGBTQ means. And that's okay, because that means that we're starting someplace and people are asking those questions. The other thing that Child Welfare is doing right now, we've partnered with the Center for Children and Youth Justice that's based here in Seattle. Have folks heard about CCYJ? Just getting nods and hands, that's awesome. And they started really doing a lot of work around what's called the Equality Protocol for Safe and Affirming Care back in 2014. And there's a report called Listening to Their Voices that came out of that. They went statewide and did a lot of focus groups around what's needed around supporting LGBTQ identified children and youth. And one of those things that came out of that is being able to invite young people to take a survey around identifying, again, their sexual orientation, their gender identity, and their gender expression, their experience with homelessness, and their resources, and their age. So it's a quick nine-question survey. Didn't want to repeat myself there. And we've been, we piloted that with both King County Juvenile Court and Spokane Juvenile Court, and in our Children's Administration Spokane office, and specifically there. We've started that in November, and we're running that pilot through June of 30th of this year, because July 1, all the magic changes over and we become DCYF. So I'm just gonna, July 1st, we're still surveying, but I'm not gonna tell anybody that. So that's where we're launching with in terms of what that work looks like. And I know Larisa and I were talking a little bit about data a little bit earlier. And right now, from what it looks like, our Washington state looks consistent with other states where we have about 10 to 12% of children and youth who are identifying as LGBTQ plus in child welfare. And as I think we all know that that can be a really static number. That depends on if a young person feels comfortable self-identifying. We're trying to get staff to not generate any data or thoughts around perceived or known SOGI. We want youth to be able to feel safe to be able to address that and talk about that. So there's a lot of just ongoing dialogue and case consultation around how we're doing that. We have new policy rolling out this July 1st. It's anticipated to roll out July 1st that will address that LGBTQ youth will not be discriminated against, that staff will ask and use chosen names and pronouns for our young people, that our children and youth will be able to dress and do their hair and express themselves in a way that they feel most comfortable with, that they will be able to access and be provided transportation to culturally relevant services, and that includes LGBTQ identified services, and that youth who are interested and have been working with a provider around gender transition services will be able to engage in gender transition services with either a court order or a bio-parent consent, and again, having been working with the medical provider. So there's some nuances around that we have to be mindful of around legalities, but we want to be able to support you in being able to access those services as well. And then the policy will also address placement, and in talking with the youth around placement and where they feel safest, and if needed or necessary, that they be provided a private room in that placement, whether it's a foster home or a group home. So we've got a lot of work that's coming down the pipe for us. It's really exciting, and I'm really excited to be at the table with my colleagues here, and really excited to be able to bring this conversation to the community. So thank you all for coming.
All right, sorry I have to stand. I'm just not used to sitting. I locked up my hands and I just can't sit. Okay, so I mentioned earlier, for some new folks in the room, we are using kind of an interactive platform today. It's called Slido. So for those who haven't, pull out your phones if you don't mind, and go to Slido, slido.com, and then enter in for the event code Critical Conversations. There's a poll, you can get a sense of who's in the room. And then also there's a questions tab, and so you can submit questions, and then that will show up and we will know what questions to ask. And if you don't have a question, you can look at the questions that have already been submitted. You can kind of like them like on Facebook, and that'll kind of bump them up on kind of the scale. So the most liked question will be at the top, and we'll kind of go from there and work our way down this afternoon. So while you are figuring that out on your phone, we're going to show a quick video. So at Amara, we have created an initiative to recruit more African American foster families to kind of help with this idea of disproportionality, since we know that there are so many Black African American kids in foster care, but the percentage of foster homes that identify as Black or African American are pretty low. And so we at Amara are really trying to recruit more African American Black foster homes to help just meet the cultural needs better of these kids in our system. So while you're getting your questions uploaded, we will show this quick little video.
From my foster care records, I was in 10 homes for from ages 2 to 4. My brother and I, who was in the system with me for 12 years.
African American and other kids of color that are in the foster care system, they remain in care twice as long as a Caucasian child.
My foster mother being Filipino and my foster dad being German and white, it was kind of confusing and hard for me to know what I identified as. I don't feel like I belong.
There was a young man that they wanted me to take, but he had been in nothing but white homes and he was not being successful at all. He stood in our kitchen and he said to me, "Everybody in this house is the same color of me." I think part of him not being able to settle down in those different homes is because he couldn't identify with them. He didn't feel a part of it.
I often do imagine how my life could be different if I was raised in a black home. I imagine loving my skin from an early age, learning how my nose looks, or how curly my hair is, and not always wanting it to be straight. I imagine just like more self-acceptance.
How many other kids want to feel that way? There are so many children of color who need a home. And I wondered, I said, why aren't more people of color taking in children?
So if it's one of those things where you say, wow, I really wish someone would help these children, or why can our society do better? I wish there were people to do that. You might be able to be one of those people.
From my foster care records.
Okay. So, any questions about the Slido? Everyone has it figured out that wants to participate on their phone? Cool. All right. I forgot to mention, if you don't want to do Slido, we have note cards. So there was some sitting on the table in the lobby, and if you want just a note card, raise your hand and we can bring you one and you can ask questions that way. Or we have the wonderful mic up front if you want to walk up and use the mic as well. Or we're probably just all over, if you raise your hand, we can get a mic to you as well, if you would like to ask questions. So we will jump right in, but I thought I realized we are going to use a lot of acronyms and terms today, and I realized that not everyone in the room may be on the same page, and so just wanted to quickly define a few things. So when we talk about LGBTQ, that stands for lesbian, gay, bisexual, transgender, and typically the Q stands for queer, but I think for our youth it also could be questioning, so they're just not exactly sure where they fall on the gender identity spectrum or sexual orientation, because they're kids, they're youth, and they're figuring out kind of what that's going to look like for them. So that's what we mean when we say that term. You may hear us say SOGI, which is also an acronym that stands for sexual orientation, gender identity, and expression. And then I wanted just to define disproportionality quickly. So disproportionality essentially means that compared to the general population, the groups of kids that we're talking about today are overrepresented. So compared to their white counterparts that were likely to enter the system for the Native American and for black children, and for LGBTQ kids, they're in the foster care rates at higher rates than the general population of kids in our state. So I just wanted to define those things, so we'll be talking about that a lot for the rest of the day. All right, so we will jump to that first question up there. So what can our community do to prevent disproportionality from occurring in the first place? And I'll let whoever wants to jump in and go in order every time. All right.
I don't think that any of these communities that we're talking about can actually prevent disproportionality from occurring. I think the child welfare system has its best to prevent disproportionality from occurring. And there are a number of things that the child welfare system can do to stop
Any suggestions or expanding upon what those could be, or is that
suggestions about the child welfare system?
things that they can do to make their system?
I think though and I'm just going to focus on it.
Yeah,
Studying
absolutely.
African American community. I think that the biggest thing that people in the African American community can do is to advocate for children who are in the child welfare system. And when I say advocate, it means actually contacting your legislators, writing to them, actually going down to Olympia and meeting with them. And I have actually done these things. And for myself, as I stated, I've gone to Congress about this issue. Unfortunately, my go-to person is no longer in Congress. And so I have to establish some new relationships. And the other unfortunate thing right now is the current administration is really not concerned about child welfare. It's just not on the radar screen, but that does not mean that we should not be advocating for children who are in the child welfare system.
I agree exactly with what Dr. Harris said. It is a system-wide issue that needs to be addressed, but specifically regarding Native American populations, I think one of the things that I see would prevent children from coming into the system is we have a significant lack of mental health services and treatment services, specifically treatment services that will allow for families to participate together or for a parent to take a child with them to treatment. And when we have that opportunity, since that is one of the primary issues in the Native American community, is the addiction issue. When we have facilities that are able to take children and a parent with them to the facility, then we're reducing the amount of children coming into the system as a whole and end up in placements that are outside of family, and it keeps the kids together. So the same thing with mental health and just ways to advocate for those services if any time we have an opportunity, because we really need our funds to go in that direction if we're going to help reduce this issue.
I want to expand on both what Dr. Harris and Larisa have said, that, and with respect to Dr. Harris's comments, I think that it's bigger than just the child welfare system getting fixed. I think we have a lot of systematic repression that needs to be addressed, whether it's in the child welfare system or the juvenile justice system or the school system or in the socioeconomic systems that we're all engaged with. And I like to put forth that child welfare is at the table with all of you in making the systems better and addressing the disproportionality. I'm not going to sit up here and try to say that racial and ethnic disproportionality doesn't exist in child welfare. It absolutely does. And I also know in this point in time what we're doing in trying to address that. So I know that I'm not up here to particularly talk about racial disproportionality in child welfare, but LGBTQ disproportionality in child welfare. But I think in many ways those overlap because we also see an intersectionality between the two. And for me, it's really about what comes before children enter the child welfare system. What is happening in homes and how our community is helping people in their homes of origin support, thrive, live better, do better. What are your other communities look like in terms of your families, your faith, your ethnic, cultural, other organizations and systems that might be in place to help. And then how does that system then, if the child is removed from the home and in child welfare, how do we then bridge that gap so that people are staying with people that they know? So similar to kinship care or and being in child welfare, there's a network that child welfare caseworkers should be building with parents, biological parents, and also with fictive kin in terms of being a resource for those children. In theory, we don't want to keep children in child welfare forever, right? Initially, it was meant as not as a stopgap, but as a place to be supportive to help families. And so we do have programs in place to prevent children from coming into care, to better help support the families before they come into care. And once they're in care, then what can we do to be better to reconnect and reunite those families? And again, data is going to tell us some of that, but data only tells us part of the story. So the qualitative data has to go with that. And some of those concrete things might be, can you help transport somebody to medical services? Can you take somebody to an event? Can you provide childcare if somebody has to work a non-traditional work hour? If you identify as LGBTQ and the family that this child has come in from doesn't, can you help be an ally for that child? There's lots of ways that we can try to keep those voices at the table to continue to educate and support that young person in thriving.
Cool, thank you. I see this question up here, or I did see the question up there. I think it's kind of tied to this, and the round question of how do we make our child welfare system in Washington anti-racist and not just more aware. So I feel like that's kind of tied to that initial question I just asked, if anyone has any thoughts about that question.
That's a really big question. I'm not sure what I would add to what the comments were before, and I don't want to step into Dr. Harris's light in terms of talking about disproportionality, what we're addressing now. And again, I would just kind of reiterate around the LGBTQ youth, what we're, why that's not racist necessarily. There is, again, some intersectionality there, and there is homophobia around that. So I feel like that, people talk a lot about training and the importance of training, and I think that really key part about training is really opening up that dialogue and providing language and comfortable spaces to have those dialogues in, so that we can examine why kids are coming in, what that dialogue looks like between bio parents and law enforcement and a caseworker, if they're debating whether or not a child needs to be removed, if they can stay in the home. It really is, for me, about checking personal bias before we can change the system. I think I'm simplifying.
We each have to check our own personal biases, our own prejudices, but in terms of systems have to decide themselves if they're going to be anti-racist. And there are a number of evaluations tools that a system can utilize in order to assess itself, and it has to put proactive measures in place.
Cool, thank you. Let's see, how can we keep tribes and appropriate and relevant cultural practices at the center of serving American Indian, Alaska Native youth in the child welfare system? We've got a deep audience today, yeah.
Yeah, no kidding. That is part of what, right now, the contract that I have with Fostering Together, part of what I'm supposed to do is to reconcile, restore, repair, build relationship between tribes amongst one another, as well as their relationship with the state. It's a lot to do in 10 hours a week. But bringing those pieces in, a lot of the work right now is still repairing and helping tribes and the states see one another differently. And again, it's back to checking the biases and checking the assumptions and being willing to educate yourself on what the history is and why the distrust and all those pieces. And a lot of it is the tribes coming in and, one, feeling welcome to come in with what they want to bring, but also encouraging them to do that themselves, because sometimes they don't want to step out. When you're dealing with a lot of the tribal traditional things that kids may have been exposed to prior to coming into care, a lot of those things are held still very close, and so they don't want to bring that out into the general public. And so just working with the tribes to do events that are more open to the public, and they are being more welcoming to that idea, especially regarding kids in care. And so there are several tribes doing activities, powwows, for example. We use United Indians. We're having a powwow on the 19th of May where it's welcoming to all the foster care kids and the families. And it just gets complicated doing this piece. And I think attending those events, when you see them, that helps, especially for foster parents, making sure if you see something that you make foster parents aware. And if you are a tribal member, accompanying is a huge piece, because a lot of times foster families feel uncomfortable going into these situations that they haven't been exposed to before. So if you're a tribal person, and that's something you very much could do, is accompany to an event like that to explain protocols, what's happening, and to help the child and the foster family feel more comfortable.
All right, let's see here. I guess we'll start with what should foster parents know about supporting children from these populations if those foster parents are not from those communities themselves? If that makes sense.
When a foster parent is not from a community and wants to take a child into his or her home who is different, be that racial difference, ethnic difference, or cultural difference, it's the responsibility of the foster parent to learn about that child's background, be it racial, ethnic, or cultural, prior to taking a child into the home. It is not the responsibility of any child no matter what that child's orientation, coming into a foster home to educate the foster parent. I also think that social workers have a responsibility to train prospective foster parents regarding racial, ethnic, cultural, sexual orientation differences prior to, again, placing a child with a parent who identifies as being different from that child.
And I would concur with Dr. Harris. I think a foster parent who identifies as what I would say straight, certain, and cisgendered has a responsibility to take responsibility for training and opening themselves up to what it means to have a SOGI that doesn't, a sexual orientation, gender identity, and expression that doesn't identify or correlate with their own. And we're developing training for caregivers specifically. They can take it online, which I know is not a magic answer, but a webinar online is something that's better than nothing. And they can also take it in person, a face-to-face training. I know Amara is working on developing a training as well for parents around LGBTQ and Children's Administration. I have one that I deliver around the state, and it's really quite refreshing actually to see foster parents come into the conversation and caseworkers come into the conversation unknowing and uncertain and worried about saying the wrong thing and walking away feeling even just a little bit better about having a little bit more information. And part of that too is wondering, what if I say the wrong thing? Or what if I don't do this? Or what if I don't do that? And really trying to encourage them, it's okay to ask questions. It's okay to say, that's a new term I haven't heard before. Can you help me understand that? A clarifying question is not the same as asking the child to do the emotional lift, as sometimes we see young people who identify differently are in that role. And I know I have felt that way in being female and being mixed, that sometimes I'm in a role, I'm tired of being the educator. I just want to be able to exist in the world and be okay with that. So I think we see our cultures, our environment changing a little bit around that. If I couldn't, can I keep talking? We good on time? Okay. We had a parent actually call in, this is probably about 6 months ago now, and I got the case awareness from it, the caseworker, where we had a child at the age of 7 come into care, and I don't know why the child came into care. Child came into care, caseworker and the caregiver met, and the caregiver took the child to, I think it was Target, to get some new clothes. The child was born, sex assigned at birth was male, and when he got to Target, where do you think he went to pick out his clothes? He went to the girls section. And the caregiver was really uncertain about what to do at this point. Not in a way that was like, blow up in your face, but like, I see where the child's going, and I see where the child is going, but I think the child's, and was really confused about which direction to go. And again, not knowing why the child might have been removed from care, wanted to be able to, we'll say, stay neutral about it. By the time they left Target, the child had clothes from the girls section, for lack of better words, and some gender neutral clothes that they had picked out together. I think the caregiver was trying to be really self-aware around if the child had been removed because of their gender expression. They didn't want to continue to instigate any tension from the bio family, but also wanted to recognize and provide space for that child to express themselves the way they felt fit. And the child, according to the caseworker, again, I understand that I'm getting this secondhand, felt really good about having voice and being able to make those decisions, those really small decisions about what they wanted to bring home to wear that day. And I think that's a new conversation that Children's is having in terms of what that looks like from the caseworker to the supervisor. Now we have a program manager and we have leads in the regions to help dialogue some of those things, which is where some of our policy is coming out of. So I think that caregiver did the best she could with what she had, and totally give her a gold star. I totally give her a gold star for that.
Open to learn, like what Jay was saying, you have to be open to learn about the kids and what's going on with them, regardless of what their ethnic, racial, gender issue may be, and we have to be open to learning from the kids. And I think some specifics around Native Americans is there are some very specific cultural things that seem to cross across tribes, and people sometimes will make the assumption, well, they're just Native American, or they're Indian, or they're Native Alaskan, so it's all the same thing, but they are so unique, just as unique as all of your families would be. And so one of the things though that tends to cross cultures that I see foster parents have some confusion about a lot is the extended family connections that happen in Native American families. So a lot of times the kids you're caring for will be talking about their sisters, and you're like, how can they possibly have 34 sisters? I don't think that's possible. And then as you have these conversations, you realize that they're often cousins, or my auntie this and that, and you think all of a sudden that this child, their mother or father had, again, like 34 siblings, and that's not the case. Because the families are so tight-knit, and when you're in a tribal community, it's like one giant family. So that's a very specific thing to know about Native American families and kids that come in. I think it's also very important to educate yourself on historical trauma and intergenerational trauma. Those pieces are huge, and the intergenerational trauma, I think, crosses across the board with kids who are in care. I mean, often that's what we see with kids in care is their families have had long histories of trauma, but specifically with the historical trauma of Native American communities, educating yourself and not just relying on what you learned in school, because the information that you learned in school did not cover, I guarantee you, most of what needed to be said. Also, again, just identifying those biases is always the case, and not making assumptions, because what does being Native American look like? Well, for me, it looks like I look like my dad, German and Jewish, but my mom is Native Alaskan. So I grew up in a family, I heard Dave say, it's different being mixed, and so I grew up with the unique experience of being in a Native American, Native Alaskan family, and I was the only white one, but I didn't know that until I was 5, when my kindergarten teacher told me, oh honey, you're not Native American, you were just born here, so that's why you're saying you're Native Alaskan. So it was interesting to have that experience because you identify often with what you see. And as a child, I saw brown, and so I just assumed that I looked like everybody else. So I didn't know that. And those kind of assumptions and those biases exist very strongly with caregivers who are caring for Native American children, especially around the issues of permanency, because often tribes don't permit adoption. And that, again, ties back to that historical trauma and the distrust. And so just, for example, last week I got a call because I was dealing with a foster parent who made a comment in a family team meeting that the infant they were caring for was too white to be Native. So what was the big deal with ICWA? What was happening? And why could this child not be adopted? So those kind of assumptions based on that kind of look and just looking at the outside is very prevalent in Native American communities, and it happens, we do it to ourselves and our families. My family, for example, we grew up in Alaska and had cruise ships come in, and so my siblings got to do the Native American dancing, and I was told, no, you need to go sell the garnets and the flowers because no one's going to believe that you're actually Native. So it happens all the way across the board, but I think being aware of that, and it's very easy, and it's a common bias to assume someone, if they are Native American or Alaska Native, they're going to have dark straight hair, they're going to be brown, and that's what it's going to be. And so that isn't the case, and so being very aware of that, I think, is important.
Thank you. There's a question, and I'm curious to follow up, talking about kind of the correlation between the boarding schools and slavery and kind of the foster care system. And I'm curious if you can like give a little bit deeper kind of historical context around ICWA, the Child Welfare Act, and the boarding schools, and kind of how that's played into kind of how foster care looks today.
Well, it plays into the distrust for sure with what happened. For example, my great-grandparents met in boarding school. Alaska's different because we didn't have the same sort of overtaking that happened in the contiguous United States. And so we're still, for example, my tribe, we are still waiting. I'm technically landless because they had us register when the federal government came in, and the Alaska Native Claims Settlement Act happened in 1971. So that's not that long ago. And then ICWA wasn't instituted until 1978. And so that's really not that long ago. And when you make the considerations about for the distrust and try to understand that and think back to that all Native Americans weren't even, I believe it was 1957 was when all Native Americans could finally vote, because those decisions were made by states, not as a federal decision. So there's just a lot of those pieces that make it very complicated. And then when you go back to the boarding school piece, that's what gets triggered so often in the communities when you have, most of the tribes require services from the state for CPS. So it feels very much like that to them, is, you know, you're coming in, you're taking our children, and that is just, it's not that long of a history. In Alaska specifically, my grandfather remembers growing up as a teenager, there were still signs in the stores that said no Indians or dogs allowed. So that's not that long ago, we're looking at like the 40s. So those kind of things are very fresh and new, and so I think keeping that in mind, especially as child welfare workers, as CPS workers, just keeping that in your back pocket and in the back of your mind the whole time you're having those conversations, is that this is going to be more difficult because of those stories.
Thank you. And then Dr. Harris, do you have any comments around kind of the history between slavery and kind of how that's going to be morphed into or influence kind of the current foster care system and how it works with Black families?
Sure. During slavery, as probably everyone in here knows, Black children were sold, taken away from their parents, no questions asked, just stripped away. And a lot of Black and African American families feel that when their children are being taken away from them, no matter what the reason is, it equates to what happened many years ago during slavery. So it's very difficult. The other issue as it relates to African American children and the current child welfare system is it's very difficult for these children to be reunified with their parents once they're placed in the foster care system. And again, in the minds of many families, this is like slavery time for them. And so I think that what is really important for Black families, for African American families, is if a child is going to come into the system, child welfare workers, social workers, case workers need to do whatever is possible to return that child home in a very expeditious manner. Children should not be growing up in the child welfare system, but yet we have kids who age out every year, which means that they've spent most of their life in the system.
Thank you. Well, I'll go to this new question here because I think it ties into this. So what supports are out there for kids of color who have been impacted by the trauma of racism within the system? And are there any specific resources out there for kids of color and foster care to help process some of that related trauma? I know I can't think of any, but experts?
So there are some supports out there for children of color and other children who are involved in the child welfare system. There are agencies like Big Brothers Big Sisters, children can have mentors, and there are also churches who do care about kids. There are other organizations. I'm a member of the sorority, and we certainly care about kids who are in foster care. And I myself do not have time to mentor a child at this point in my life, but I have done it in my younger days. In addition, there are a lot of service organizations, the Boys and Girls Club of America, Girl Scouts. For me right now, in addition to children in the child welfare system, I'm concerned about kids who are impacted by parental incarceration. And again, we're talking about children of color who are overrepresented in that system. And again, Girl Scouts has been just tremendous in terms of kids, not only who are in foster care, but kids who have incarcerated parents. Girl Scouts Beyond Bars does an amazing job for these kids. And again, there are mentors, there are service organizations that are not connected with the child welfare system, but are good resources for these children who are in foster care.
Thank you. Maybe there's a pretty popular question, so maybe to expand that question a bit and just say, what can folks do in the room to support kids who are overrepresented in the foster care system, but for whatever reason can't step up to become a foster parent? What other ways can they get involved to support these youth?
anybody out here can actually mentor a child. Mentoring is very important.
I would echo again what Dr. Harris is saying about being part of maybe another agency or organization or group. I know I live in Olympia, Thurston County, so I can speak most solidly about that. But one example that comes to mind is a group called Pizza Clutch. And Pizza Clutch is a group that's provided in the high schools for LGBTQ plus youth to come, and then one of the benefits, of course, is that it can come to a group that's facilitated by other adults that identify as LGBTQ, but if they're already on campus attending school, and if for some reason they're not able to access those kinds of activities when they're at home or without transportation, that they have access to that support group. Part of it too is just getting with your people, right, and seeing people that identify like you, who look like you, who are like you in many ways, and that can and you all in the room are somebody who identifies somehow with some other group, and finding ways to find it and build that connection for youth and care, I think is really critical. And I absolutely understand that, of course, that requires time, but time is something often we have to give, even just a little bit each month. So, and the LGBTQ plus community in terms of support is growing vastly, especially for children 11, 12, and up. I know that more and more we're looking for resources for children who are under the age of 12 to have resources and get together with other children who might identify somewhere along the spectrum. But that's also something that is growing, I think, in terms of across the state and across the nation. But just echoing that, getting involved that way is really crucial to the young person feeling like they have a sense of belonging and their sense of worth. We often hear over and over again from young people, not just in the foster care system, but may have experienced homelessness or maybe part of the juvenile justice system, or didn't just have a crappy life at home, that it just takes one person. It takes one person to make a difference. And there's no reason why that one person can't be anybody sitting in this room right now.
One specific thing that I see too is there's always a lack of visitation supervisors for kids in care, and we know that it's important to keep kids connected to their biological family, and that's one of the things that helps the parents stay engaged too, because it's got to be incredibly difficult to go sit in a room somewhere that's sterile and that's the only thing that can be offered. And so anything that communities can do around supporting more natural visit spaces for families to come to would be amazing, so that the kids aren't sitting in these sterile offices or constantly being McDonald's playland, because that's where they have to go. And also the transportation for that, I mean, that's huge. Transportation, not having, parents don't have transportation, so if you don't feel comfortable with the child, maybe you feel comfortable taking the parent to that visit. So that's a good thing to get involved in. And also, I feel like anything that you do, kind of to echo what they were saying, is that you can connect with somebody. There's something special about you, there's some special skill, there's some special likeness that you could identify with a child. But whatever the resource is that you can bring it so that it doesn't add to the plate of the caregiver. Because often community is saying, oh, we have this great thing for the kids to do, but then this foster parent has to try to get them there. So anything that you can do to reduce the amount of work that you would put on the foster parent when you're bringing this awesome resource, that would be great too.
Yeah, and I'll just add my 2 cents too. I think, yeah, there's foster parents and foster children in every community, and so, you know, maybe at your church there's one foster family, so maybe use a church kind of wrap around that foster family and provide them with meals, help them with transportation, childcare, ways to get involved with our young kiddos in general, but definitely our youth and foster care in our communities. Alrighty. So this is a pretty popular one too. So as a white person, I worry about possibly doing more harm than good by fostering, adopting children of color, instead of those kids going to a home that looks like them. Kind of, what are your thoughts, or what would you say to a white person who's hesitant about taking in placement of kids in color, or a straight person taking in LGBTQ kids?
I would say to a white person who's going to take in a child of color, learn as much as you can about that child's cultural and ethnic background before taking that child in. And make sure, for example, if it's an African-American child that you're going to take into your home, make sure that that child has contact with and exposure to other African Americans. Way back in the day, when I worked for the Children's Home Society of Florida, I actually placed black babies with white families, but I made sure that they had a connection to the black community prior to placing that child, because it's important for children to know where they came from. This helps them to be comfortable if they're going to be in a home with somebody who doesn't look like them.
And I would add also to that, thinking of the straight cisgendered certain parent who wants to foster or adopt an LGBTQ plus child or youth, is again to educate themselves beforehand, and then keep that education going and find support for yourself as well. There's supports for parents and caregivers. PFLAG is probably the most popular support, and it's okay to not know. Continue to find that support for yourself, because it's going to be, some things are going to be challenged, even if that child is biologically yours. There are some things that are going to be inherently challenging, and so it's not just support for the young person, but it's support for yourself. And I don't think that we do enough around, I don't know if I want to call it self-care, but just again, finding someone with the likeness as yours to walk through that journey with you, so you're not putting the emotional burden on the child and the responsibility on them to educate you and to do that part for you. I think it's also very crucial to provide those cultural and social activities for young people in terms of and I'll just again continue to speak about the LGBTQ plus community, if those are activities they want to engage in, then to support them in accessing those activities, as well as providing transportation or volunteering or in any other way that you would support something else. If your child was in Scouts or in theater or in football or whatever else it was, and support the child in the same way.
I would just want to make sure and encourage people to foster regardless, because if you're capable of loving and caring for a child, love and care for a child. And that's the primary piece. And then with all of the education pieces and supports, just identify those and don't just stay stuck in your box of what you think you know. And educate yourself, but primarily love the child, because that's what they need the most, just a safe, loving place until.
Great, thank you. And I wanted to check, is there any audience questions from anyone who wasn't able to access Slido? Okay, we will continue going. So I guess one question for you, Dave. I think you talked a little bit about this, but if there's anything else you want to add, can you talk about some of the work occurring to help LGBTQIA+ / SOGI youth in the system?
In addition to whatever you said?
Yeah.
Maybe. So I want to clarify too, because I think we made an assumption even with your definitions that folks in the audience know the difference between SOGI and LGBTQ. The question says LGBTQIA. So I tend to use LGBTQ+, just respectfully to acknowledge the other identities that aren't there. So SOGI represents everybody in the room. So again, sexual orientation, everybody has one. Gender identity, everybody has one. Gender expression, everybody has one. And being LGBTQ identified is, dare we say, a subset of having a SOGI. And more of our language, I think, is encompassing using SOGI as part of that, but wanting to differentiate between the two. So I just wanted to call that out as well. So I guess I would highlight that some of the work that, it's not, I don't want to minimize, but I don't want to glorify at the same time, but it's kind of a big deal that Children's Administration hired a full-time LGBTQ headquarters program manager, right? I mean, hello, we're saying it out loud. So not only did we do that, but then we also created LGBTQ leads. Currently we're in 3 regions. We'll move to 6 when we move to the Department of Children, Youth, and Families, DCYF, in July. But again, having those resources available, training has been a really big deal. We currently, all our training is provided through a separate agency called the Alliance for Child Welfare Excellence. And they are contracted with a person by the name of Jude McNeil, who used to work at Odyssey Youth out of Spokane and is now based in Eastern. And Jude provides training, I'm going to say about 6 to 10 times a year. I'm sorry, I'm not current on their schedule right now. But one of the things that's happened is that while I partnered with CCYJ in promoting the equality protocol for safe and affirming care and in developing my own training, if you will, and inheriting the work from Marian Osman-Wells and Jeannie McShane Hollywood, and prior to me doing this work, I started going out and providing trainings to caseworkers, and part of that was because I was just more accessible. And every time I go out and do a training, 2 more people want to do another training, and then 2 more people want to do a training. So in about the last 6 months, I've probably provided about 15 trainings statewide. And it's not just for caseworkers, it's been for ESD staff. Last couple weeks ago, Nicholas and I were in Tacoma for a 7-hour training, which was huge to have that much time. The week before that, we were doing a 3-hour training. On Monday at the Saying It Out Loud conference in Pierce County, we were doing a 1-hour training. So every time we go, somebody else wants more. So it's caregivers, it's caseworkers, it's it's school staff, it's CASAs, and the work is growing and the awareness is growing in terms of what's happening. And I think that's one of the biggest things to celebrate about this work, is that again, that we're providing this and we're getting into the meat of it. And providing policy that's anticipated to come out in July is also a really big deal. I think it's a really big deal. To again, just kind of call out that we're not going to discriminate, although we have an RCW that protects our children and youth from discrimination based on sexual orientation or gender identity. The RCW doesn't technically include gender expression, new language that involved. But having LGBTQ policy within Children's Administration to call that out, I think is very significant, and that it will be expected by caseworkers and caregivers to honor that policy.
Thank you. And there was a question about, is there a requirement for foster parents to take training in LGBTQ issues? The answer is no. Yeah.
Not yet.
Not yet. There's a requirement that you can do like cultural trainings, but you could do African American hair for that. There's like a wide variety of what culture is, obviously, but there's not one specifically required for LGBTQ parents. And like Dave mentioned earlier, Amara is in the process of creating training for caregivers who are caring for LGBTQ youth or interested in caring for them, that we're going to have in Amara, but it'll be open to all families, and we're also then going to hopefully create a support group attached to that so that families can get together and kids can be around kids that identify in the same general community as them, and then also the parents can get ongoing support as they kind of navigate parenting. So, yeah.
Absolutely. Can I tag on to that as well? Yeah. So one of the things that, there's a newsletter called the Caregiver Connection newsletter that goes out to caregivers, and so I've been able to provide 3 articles at this time around the work that's happening with LGBTQ youth. And again, the feedback even from the caregivers that are reading the newsletter has been positive, which is really exciting. And we'll have caregivers on our LGBTQ advisory board that will go live in June.
All right, so let's see here. So we're coming close on time, so maybe a few more questions. What is being done in terms of prevention to stop or slow the flow of children, particularly children of color, from foster care to a cycle of incarceration? So that might be Dr. Harris' question. Then you write about incarceration, because we're about the parents, right? But
I do.
yeah. Do you think you can tackle that? Can we read it again? It's that second one from the top there.
I can't think of anything specific that's being done in the state of Washington. I really
Okay, what would that
can't. Because unfortunately we have the prison pipeline that's collided with the kids. I said that I can't think of anything specific that's being done in Washington State to avert kids in foster care from coming into the criminal justice system. I think, in fact, I know in terms of children of incarcerated parents, again, some of the same things that I talked about in terms of children of color in foster care. Kids need services. When a parent is incarcerated, and it is a myth out there that says if you have an incarcerated parent, you're going to also become incarcerated. And that's not necessarily true. What kids need when a parent becomes incarcerated is to be loved and cared for and not stigmatized. Incarceration right now is considered an adverse childhood experience. and it's considered an adverse childhood experience because of the stigma and shame that's attached to incarceration. Unfortunately, for children who have incarcerated parents, teachers stigmatize them, which should not be, because children have not committed a crime when a parent goes to prison. They have not done anything wrong, but unfortunately, we in our society still stigmatize them. Babies, for example, have parents who are incarcerated, and when children are removed from a parent at birth, a newborn, that child gets off to a very bad start because he or she is not able to attach to that parent. And again, Trey, I don't have an answer to averting kids from the criminal justice system by virtue of the fact that they're in foster care. Because actually, sometimes we're talking about the same children. We're not talking about a new group of kids.
I have a couple, there are some programs that the state does have that I think do help if you look at how it might apply to providing kids with services. So when kids turn 17 and a half, we're mandated to have a meeting for them, and at those 17 and a half meetings, that's when the social worker and a team of people typically get together for that child and discuss what their plans are, what are you going to do next. We talk about a program called Foster Care to 21, and so the children at that point can opt in to stay in the program until they're 21 with state supervision, but it's a lot looser. But they can go to college and still stay in the system, technically in the system. There's also a few programs out there. YouthNet is a program that kids can connect to, I know in the north, where they check in once a month and they can stay involved in that program till they're 23, and they help them with education around getting an apartment and finances and things like that, and it gives them someone to stay connected to. But I think that's a huge need and a huge piece that community can do, is connecting with those teens that, where do they go? Like if they do go to college, I always worry, like where do they go for Christmas? Like where do these kids go? Who do they hang out with? So that's a huge piece.
Washington is having a conference in September over in Eastern Washington. Go to their website and you can see the dates and the place. It's a 3-day conference that's going to start on Friday and it goes through Sunday. And I want to say it's around mid-September. Send me an email and I'll tell you. I'll go home and look it up. But read, because there are so many webinars that are going on that don't cost any money. Conferences tend to be very expensive. But you can certainly go to your library, go online, access college libraries, ebooks, all journals now come electronically. And there's a wealth of information out there regarding racial disproportionality and child welfare.
I was going to say the same thing, read, just research with the Google, like simply just Googling ICWA. You will find a ton of things because there'll be links all over the place. And there are actually some really good things too on, you have to be careful because sometimes it's not authentic, but on YouTube, sometimes there's some really great movies you can find that are more independently produced, and there are some great things, and you can contact me if you're interested and I can send you some of those links.
And then Amara is starting kind of revamping our newsletter, and so there's a sign-in sheet out there. We promise we won't spam you, but we want to continue these conversations, so we'll have our upcoming events and stuff in that newsletter, so if you sign up for that, you'll be notified of future events that Amara will hold around this topic and others related to it. All right, so the final question. If you could wave a magic wand and create a different child welfare system, what would it look like? Dun, dun, dun.
Wouldn't it not exist and we wouldn't need it?
There you go. Mic drop, panel over. Any other? That everyone's answer? I mean, that's a great one. Okay. Well, so we have one more question then. Let's see. Well, I guess this was popular for you, Dr. Harris. For you, Dr. Harris, they want you to say more about the specific things that could be done to reduce disproportionality. So anything that we haven't talked about today around reducing the high rates of kids of color is probably what they're focusing on in that question.
I mean, one of the things that's already being done in Washington State is family assessment response. And what that means is, and in some places it's called differential response, it's been working for years in other countries. It's actually doing an assessment of a child prior, when a call comes in, actually going out and assessing for risk. And if that child is not at high risk, putting services into the home to keep that child in the home, rather than bringing that child into the child welfare system. And I've always said, and it is in my rating, that we need to be more vigilant when these calls come in to CPS, rather than just immediately removing kids from the home. Put as many services as possible into the home to keep children with their parents. And of course, I'm not saying that we should keep kids in their home if they are at risk of harm. But when you can keep a child with those parents, this definitely will reduce the number of kids of color who are coming into the system. And then when we bring kids who really have to come into the system into care, we need to be doing and providing as many services as possible to reunify kids with their parents. I firmly believe that kids thrive and do better when they're with their families than with strangers. And again, what happens to children of color, they stay in the system longer, and then there are service disparities once they come into the system. And these are things that we can actually do something about. I see no reason that all children should not be getting equitable services when they're in the child welfare system.
Yeah, and I think one thing I would add, even though the question wasn't for me, in this state we do a pretty good job of placing kids with kinship families, so relatives or someone that has a prior connection with that child. But the support they get versus a licensed foster home is completely different, and there's just basically nothing. Well, there's some out there, but compared to foster parents, it's not the same level of support. And so I think we as a community, I think, could be better to adequately support our kinship families and really knowing kids do better when they're in kinship homes than in traditional foster care, and really supporting those families and giving them all the resources they need to, if that is what needs to happen in place to
I agree
not a
with you
home.
about services for kinship care families. Not only do these families need to be provided services, they need to be educated about how to utilize the system and how to get services. Someone who is 80 years old and trying to parent grandchildren or great grandchildren, they really don't know how to navigate the child welfare system or any of these other systems that they need to be able to navigate in order for kids to thrive in their home.
Great. Should I do one more question? Looking up top to the control panel. All right, one more question. I think, yeah, this is a great one. We should have covered this maybe earlier, but can you share why most kids come into foster care? The assumption is neglect related to poverty, and how that then leads to disproportionality of kids coming into the system.
Most kids come into care because of child neglect, and it's typically child neglect because a parent or parents are utilizing substances. Poverty in and of itself is not a reason for placing kids into care. Let's be very honest here. Nobody wants to be poor, but we live in a society where we're always going to have some people who are at poverty level or below poverty level. That in and of itself is not a reason to bring kids into care. And I don't have a solution regarding poverty. The other myth that's out there in terms of kids of color coming into care is that families of color abuse their children at higher rates than European American or white families, and that too is not true. So again, getting back to the poverty issue, I don't have a solution for that, but again, removing kids simply because they're poor is not the answer. And no child should be coming into care just because he or she lives in a family that is at the poverty level or below the poverty level. And again, child neglect is usually because parents are abusing substances, either alcohol and drugs. And the issue here is that once these kids get into care, parents are not receiving the services that they need. For example, mothers whose children are coming into care who are abusing substances. There are very few substance abuse treatment facilities that are gender specific, for example. There are very few in Washington State that will take a pregnant woman who has a substance abuse issue. And so these are problems that we need to be working on in order to avert these kids from coming into the system.
I think with the Native American community, again, it's different in the sense that, yes, it's disproportionate when you're looking at the overall population. However, we're dealing with a smaller group of people, and so obviously if you take 1 out of 10 versus 1 out of 100, your percentage is going to be greater. But in my experience over the last 10 years, I would say that it's, yes, disproportionate, but not necessarily inaccurately disproportionate. Because of the addiction issues, especially that are on the reservations, it is just, it's horrible. It is horrible. And I think some of the common things that I still hear about why Native American kids are in the system are just some of those assumptions and biases, but the reality is it's most often neglect due to, again, just the addiction. And then there's such a long history of the intergenerational trauma, and you need to go back to boarding schools, what caused this, and so you have a breakdown in people's ability to even know how to parent because you had a generation that wasn't parented, and it just keeps going. And so that is the primary issue. So yes, disproportionate, but not necessarily wrongly disproportionate based on the issues that we're seeing on the reservations and the trauma that's going on.
And I would like to add that I want to be appropriately cautious when generalizing, that we do have a higher number of single-parent families that are becoming blended families, and often that stress of being in a blended family can escalate one of the partners if there's multiple children or they're not had parented before. And so while neglect is definitely key in or part of the number of children coming to care, so is blatant abuse and the beating of a child. And we're seeing those numbers increase as well. We're seeing numbers around trafficking increase as well. So there's some other significant things that are happening to not just the environment that the child is living in, but the actual physical abuse of the child that would also be a considerable factor for why a child.
And there's a question about CSEC kids. Can you just talk a little bit about your work with that population?
Sure. So I'm also the CSEC program manager for headquarters program at Children's Administration. So in 2000, I think I nestled in 2014, the feds mandated that all child welfare agencies identify, assess, and provide services for commercially sexually exploited children. I'm going to use the term CSEC to replace saying all that out loud. And in 2015, in Washington, we did a couple of things. One, we hired this amazing person here in Region 2. Her name is Marian, and she's the CSEC Liaison for Children's Administration. We also then worked very closely with Rainier out of Youth Care, who's nationally renowned for her work around working with CSEC survivors, and developed a training that we then provided to two groups of child welfare staff, our missing from care locators, as well as our child health and education tracking screeners, so CHET. Screeners are people who gather information if children are coming into care for 30 days or longer. So the idea behind piloting with both the missing from care and for the CHET is that missing from care are going to catch kids who are coming back on the run and have an established relationship, while the CHET screeners are going to catch any child coming into care and screening those 11 and age up. And so we did that from December 2015 through well, they're still doing it, but I'm trying to backtrack in my head. So, and then in in June of 2017, we finalized our policy and began providing mandatory training around CSEC for our caseworkers. So caseworkers are also now required to, we have a screening tool that was developed, and so Potentially a child is getting screened if they're 11 and up by a chat screener. If they run away and come back, they're getting rescreened by a missing from care locator. If they stay in care and never run away, but they show indicators of being trafficked, then they'll be getting screened again by the caseworker. And what that does is then help to create that story. It's amazing how much the training has influenced how our caseworkers are looking at kids and those indicators differently. These are people who have been working social work for many years, and all of a sudden, once you get this training, it just, this new light bulb goes off and like, oh, now those pieces start to make sense in terms of what those behaviors might be. And a child can engage or have all those indicators and still not be trafficked. Absolutely, that can also be part of the story. And what we're also able to do is then connect with some of the, we're also present on 13 different task forces statewide, which covers about 80% of the population in Washington. Not every county has a task force, but because of that work, then we're also working very closely with law enforcement, advocates, providers, CSEC survivors as well, in helping to find more resources and advocacy and supports for both caregivers and youth. If you're in King County and interested in being a caregiver specifically for CSEC survivors, let me know. That's an unofficial recruitment because I'm not allowed to recruit caregivers. But there's a specific program called Connect Up that's a partnership between the YMCA, Youth Care, CCYJ, and Children's Administration to help develop that. So because those children need a special kind of service and caregiver to care for them.
Cool, thank you. Well, we have reached our end of the time. A couple things. We're gonna have a reception afterwards. So if you stick around, we'll kind of mingle. The panelists will be there. You can ask questions of them or me afterwards. Also, we are going to take note of the questions that were answered, and we, Amara, will try to turn these into a blog post and talk to either the people up here or other folks and really answer these questions and get that disseminated. And then last but not least, if you are interested in becoming a foster parent and you identify as Black or African American, we're having an event on June 19th at the Hillman Collaboratory, just in like the Hillman City area from 6:30 to 8:30, just to kind of get together. There'll be some appetizer, and we'll just talk about the need for more Black homes and answer any questions about taking the next steps in becoming a foster parent. So on that note, thanks everyone for coming, and hopefully we'll see you at the reception. Thank you to our wonderful panelists too.